Hello, good evening, and welcome back. COVID-19 vaccine allergy warning over new jab. The one that is definitely safe and has gone all through the rigorous testing that is necessary. And this is not at a at-risk group like the over 80s. This is instead of NHS workers, as in frontline staff. This is not particularly serious in terms of anaphylaxis, which can be fatal. It's Aphylactoid, which is more of a skin rash, and both these people had EpiPens with them, so they could be treated straight away, and after a few hours they did recover. And this is 2 people out of several thousand who have received the vaccination, so the initial results from the vaccination have not been as severe as having the coof, essentially. So the vaccine is safer than the coof. Of course, then it comes down to whether or not it is as effective as it is supposed to be at preventing the coof from taking hold, and what are the other long-term effects from the vaccination. Those are the results of which we still do not know, as in, could it then lead to other health implications further on down the line, could lead to sterility, cancers, a higher risk of other diseases, that kind of thing. Those are answers which we don't know. And we cannot know until a few years have surpassed, and then we can try and collect data between people who have received a vaccination and people who haven't, and that is what vaccinations normally go through before they're then certified as being safe. But of course this one is trying to be expedited, and the US have their Operation Warp Speed in order to try and get this done faster. Unfortunately, biology can't be sped up in that way of knowing if there is a longer lasting effect. We simply do not know. The main one, of course, where things were rushed through and there were problems later is thalidomide for the morning sickness pill, which then led to children with deformities and without limbs. That's one there that was, of course, deemed safe at the time. And we've seen other widespread experiments on the population which only came out later. For example, with the Operation Orange, with the Vietnamese War, or saying that people have bad blood because they've injected them with syphilis and then leaving it untreated in order to see how it's developed. That kind of thing then of course leads people to be a little bit wary as to what the government is trying to do, or the CIA, of course, doping people up on acid in order to see the effects of that, in order to try and hypnotize them or seduce people into doing things that they want. And the Unabomber was, of course, a example of that, as well as in a victim or patient, depending on how you view it, of that governmental experiment. That it's because of these things that have now come to light later on, now that information is more widely accessible, that makes people wary of any government rollout, especially when it comes to injecting people with things. And the only reason we know about that is because of the free flow of information, because of what the internet permits, which of course is why the governments are trying to censor information, and that isn't really done through corporations, because sure, there will be different corporations having different thoughts, but then the government steps in to encourage some corporations and discourage others, so that they have plausible deniability to say, well, hey, this wasn't government policy, this is just what people decided to do, except of course it is only because of government intervention that it enables people to do that kind of thing. With that in mind, what's happened in particular here? Well, people with a history of significant allergic reactions should not have the Pfizer-BioNTech COVID jab, regulators say, which includes allergies to other vaccinations or foods or environment, things like that, even like tree sap, something like that. So it came after 2 NHS workers had allergic reactions on Tuesday, and as I said at the top, that this isn't the over 80s, it is instead actual frontline staff of the NHS. This isn't the high risk grouping that are having these allergic reactions. So the advice applies to those who've had reactions to medicines, food, or vaccines. The Medicines and Healthcare Products Regulatory Agency said the 2 people had a reaction shortly after having the new jab, had treatment, and are both fine now. They are understood to have had an anaphylactoid reaction, which tends to involve a skin rash, breathlessness, and sometimes a drop in blood pressure. This is not the same as anaphylaxis, which can be fatal. They can both be, in a way, it's that anaphylactoid leads to anaphylaxis. So, sure that anaphylactoid isn't, because it develops into anaphylaxis, which is then fatal. But if it's seen in time, then it's not going to be as much of a problem. It's semantics at the end of the day, but hey, they're going to use anything that they can. Both NHS workers have a history of serious allergies and carry adrenaline pens around with them. Exactly, they've got their EpiPens just in case this should happen. They're aware of it, which is surprising, of course, given that they're NHS workers and their frontline staff, that despite having apparently such serious inhibitive or prohibitive allergic reactions to particular substances, they can still work and carry on with their job just fine, being on the front line of medicine. But there's nothing suspicious to see here. Professor Stephen Paris, medical director for the NHS in England, said that this was common with new vaccines, describing it as a precautionary measure. Yes, it's something that you would expect to be done before it's then rolled out to everybody. Dr. June Green, head of the MHRA, said it was only right to take this step now that we've had this experience. It's a bit concerning, though, that you're going to say something safe. After that, people are going to have adverse reactions to your implementation, and then you're saying, well, it's good we found this now. Oh, and it's definitely common. It seems to be, just like, of course, we've seen corporations being permitted to have a non-liability agreement, which is to say, if there are any adverse reactions or any problems with their vaccinations, they will not be held culpable for the negative ramifications of what they've done and injected people with. And it's very, very disconcerting to say to somebody, to say to somebody that go ahead with this. If there's a problem, it's your fault. In that case, surely the person would say, yeah, I'd rather not. I'd rather do my own research and decide upon that. For example, if somebody said, hey, you go play the lottery, get as many tickets as you want, I'll pay for it. If you lose, then don't worry, I'll cover the cost for you. But if you win, well done, you've earned that money. Then surely, because that's essentially non-liability, that you're just going to get as many as you can in as many different shops and newsagents and supermarkets as you can. You're just going to buy them all up, because if all goes to shit, then you're not going to be held responsible, because that other benevolent, idiotic donor is going to be paying off your debt. But if you win, then, hey, easy peasy. Job's a good one. That's basically how it's being done now, except of course they're getting paid in advance and saying, yeah, you can have this money and we're not going to take it from you, no matter what happens. So, well done. Well done. Enjoy your early retirement. So Professor Peter Openshaw, an expert in immunology at Imperial College London, said the fact we now know so soon about these 2 allergic reactions, and that the regulator has acted on this to issue precautionary advice, shows that this monitoring system is working well. It seems a bit too well planned to me, a bit too much controlled opposition, to say that they must be thinking, hey, people aren't going to take you too kindly to this vaccination, and they're going to expect problems. So what is the biggest issue that we can allow and it's still safe? Or the smallest issue that we can allow, but still make people think that they're right to be concerned, and yet still make it manageable and sweep it under the rug? And that seems to be what it is. 2 people out of a few thousand, that we know of, there could be a few more, but a few out of a few thousand, maybe 1 in 1,000, if that, have had an allergic reaction. There could be other unknown reactions, but as of yet, that's what we're seeing. That they could probably go, yeah, that's okay. It means we could still basically say this is safe, but for the people who think, oh, well, nothing's perfect, then their mind is going to be put at ease as well, because the unknown unknown has become a known known. And that's it. So their analysis by James Gallagher says, and I shit you not, this is a story to assess with your head and not your gut. Yeah, so when we've heard all the fear-mongering about the coof and how terrible that is and how we've all got to be terrified and not interact with anybody and just stay inside because the world is going to end, that's something obviously that's all emotionally driven. But when it comes to, well, hey, now we're injecting people with things, so yeah, this is one you should view logically and not emotionally, with your head and not your gut. When it comes to the, the fear porn that we're giving you, then yeah, obviously do it with your gut, not your head. Don't bloody think critically about this stuff, otherwise you'll realise we're lying. So yeah, we're just going to encourage that fear and anxiety and the emotional driven message to you, and just focus on that. So there's an initial fuck you in the first sentence. No effective medicine is without side effects, so you have to balance the risk and the benefit. Yes, we agree. Brilliant. In fact, it's not just effective medicine, that there's just ineffective medicine that has side effects as well. It just doesn't have a proper effect. And so always you have to balance the risk and the reward. Good. So don't you think then, James, that it's important that everybody is aware of exactly what the risks are of both options, as in one of receiving this vaccination and the other of not receiving the vaccination? Don't you think it's important that people have all that data in order to make their own decision? I would have thought that's a pretty bloody primary point of information to consider. But apparently not. No. Just, virus bad, vaccine good. Small issues, ignore them, you'll be fine. It's like, what, this is negative 0.1% of people. It's less than 1%. You don't really need to worry about it. Hang on a minute. How are they not seeing this? For fuck's sake. It's like they're willfully blind, or it's just propaganda. So remember this, 1 in 1,000 people in the UK have died after being infected with coronavirus this year, and that figure is rising daily. Yeah, oh my god, a cumulative figure is increasing daily. Don't you know that the amount of days that have passed since the start of the year has gone up every day, and it's increasing every single day? This is terrible. It's like, yeah, how many days this week? I was like, oh, it's 7. Last week, 7. Week before, 7. It's always 7, yeah. But days this year, that's going up every day. How many days were we through this time last year? The same amount of days. Yeah, but this year it's going up every day. It's like, this seems to be an annual thing. But this year it's going up every day. So, yeah, I don't think you quite know how to phrase this properly. It seems like you're not giving people proper context. But what do I know? Yeah, a cumulative figure is going up every day. That's news. Wow. That's just a statement of fact that's always bloody true. But, yeah, 1 in 1,000 people in the UK have died after being infected with coronavirus. Maybe. Yeah. Because, of course, the death toll is rather, if not incredibly, unreliable. That what they've changed it to is that people who have died within 28 days of testing positive, not all these tests are reliable, so they can't even say within 28 days of having been infected with the coof. And, of course, initially people were being put down with having died of the coof, despite not testing positive. It was just that they had similar symptoms, because there weren't enough tests to go around, so you may as well put it in. Why would that be? Because you get a lot more money if you're treating COVID patients. Seems to be like money is quite a good incentive. And if you enable a corrupt way for people to do that, they're going to take advantage of the system. Oh, seems like government intervention doesn't really work. Whereas, of course, if you had a free market idea where people could only get money if they provide value, everybody would be better off. I know my preferred outcome. I shit you not. That is his analysis. And then 2 people out of thousands vaccinated yesterday had an allergic reaction, which they recovered from. Wow. Wow. So you've got a couple of percent of the population, it's like 1.8 million out of 70 odd million, who have tested positive for the coof. 62,000 who have died from the coof, which is where they get their 1 in 1,000 figure from. And then several more that have had it but haven't had a test, because otherwise they wouldn't be able to work and they'd be fucking over their lives for those that they love as well and care about, because they wouldn't be able to work either, because they would have interacted with them and they would also have to quarantine, which is also why this kind of thing just bloody well doesn't work, because individuals will not want to be tested because they understand the ramifications, which is why this idea of this lockdown doesn't work unless you get the public on side. And at this point, they've lost public support. They had it for a couple of weeks to flatten the curve, but after it's gone on for almost an entire fucking year now, we're sick of this shit. So no, of course people aren't going to abide by the rules, because after such a bad lockdown for so bloody long, people cannot afford to not work. And I know it's bloody well fine for journalists who do not give a shit, and they get their paychecks because it's all online anyway. And for the so-called civil servants and public servants who are guaranteed their income because they're always going to be working anyway, and they might as well pass a pay rise now because they need it, because times are so difficult. Meanwhile, they're fucking over the rest of us. How the fuck are they going to get paid? Well, that's going to be through quantitative easing, which is why a quarter of the entire US dollars in existence were printed in the last year alone. And we're seeing it over here as well. So yeah, they're going to keep bigging up themselves and trying to ingratiate themselves to the public, despite not really being able to do it. But it doesn't fucking matter, because they decide how much they get paid and how much you get paid, because it's a centrally planned economy at this point to decide what is worthwhile, what is not, the times at which you can work, the times at which you can't, how many people you can work with, what is important, and they are dictating your life for you. If that is not a centrally planned economy, I don't know what is. Because that's really what they're saying. Yeah, this job's important, this one isn't. This one you can work with people, this one you can't. This one you've got to work between these set hours, this one another different set hours. Kind of reminds me a fucking lot about calling Moscow in order to ask if it's okay to harvest your potatoes. And academic agents said people wouldn't vote for socialism again. Seems like we've done it without bloody realising. So I thought that the C on the ticket was conservative, not communist. I see I completely misunderstood. Well, as we all know, if the Tories don't get their bloody act together before they call for another election, they're going to be slaughtered at the ballot box. And the bright side is that it seems Labour is splitting to form then Momentum as well as Labour. You're going to have the Lib Dems and the Greens and the Tories and then the Reclaim and the Reform as well. And it's just going to be a multitude of different parties. No one's going to get a majority, which I'm very pleased about, that you're going to split the vote so much. And maybe then, maybe, just maybe, there'll be a thought from the ruling elite to go, well, shit. We seem to have fucked ourselves over. And if you're not a fan of that conspiracy, then whoever's in charge is still going to be thinking, oh shit, maybe we should appeal to more people because we've split things up far too much. People are too isolated. Funny that. And have different opinions on things and can't come to a sensible agreement because people are too polarised. I wonder how that happened, BBC. Any ideas? But yes, the GP said it's ready to go for community rollout. Of course, you need 2 doses of this Pfizer vaccine. And second COVID vaccine is supposedly effective in elderly because they had to test it for the over 55s as well in order to ensure that it works. You have to test it on younger, healthier people first in case there are any adverse side effects. And of course, it's going to be effective on younger people. Just like how the risk from the coof is negligible amongst younger people, but now they're testing older people, so you can use that one as well. What joys. But that's how things stand. So yeah, a couple of allergic reactions, which seems to be, enough, I think, enough for the idea to be, oh, we knew there were going to be problems, aren't we so good? And then the pushback to be, yeah, they were very mild and they were cured. There's no issue there whatsoever. Just so that if anything else comes out later on that the vaccines are more harmful than they are beneficial, they can just come back to this story and say, oh, people are saying that the vaccines are harmful. However, there were only 2 cases of anaphylactoid reaction and they were fine. So they can then use this story in order to debunk, so-called debunk, all the later ones that are actually true and more serious. But maybe that's just a black pill. As always, let me know what you guys think down below. Do you think, well, hey, it's good, we're actually getting things going, and obviously the oversight committee is doing its job because now we're aware of the unforeseen side effects and it's all working exactly as planned? Or if you think, oh hell no, oh fuck no, our chances of dying from the coof initially are negligible, and this vaccine is only 95% effective, and yet it can give us an anaphylactic reaction and not save us from the coof. I think I'm going to pass. Either way, let me know down below. Always intrigued to hear what you guys have to say. And as always, until next time, have a good one.